Head and neck cancers are fairly common in the older population. About 40% of all head and neck cancers occur in individuals over the age of 65. And unfortunately, there's not a whole lot of research specific to the older population. And most of the information that we have is extrapolation from evidence that we have in the younger patients. There's some exciting data coming out of India that suggests that older patients tolerate chemotherapy just as well as younger patients do. In this setting, the researchers tried chemotherapy before surgery or radiation and found that older patients tolerated the chemotherapy just as well as younger patients did, and their overall outcomes after they completed their entire course of treatment was no different. There is a lot of interest in trying to decrease the intensity of treatment for all patients with a specific type of head and neck cancer called HPV positive head and neck cancer, and that would directly impact the older patients as well. Although the proportion of older patients with HPV positive head and neck cancer is relatively low, I think the things that we learn from these trials will be applicable to the older patients in general. There is new exciting data in patients with glioblastoma. In a study that was conducted, the researchers looked at standard course of radiation therapy versus a shorter course of radiation therapy and found that in older patients, the shorter course of radiation therapy did not affect quality of life, overall survival, or progression-free survival, but it was much more easy and tolerable, and so older patients would be better off with a shorter course of radiation therapy for their glioblastoma as compared to the standard course of radiation. One of the things that we do know about head and neck cancer in the older patients is that they're likely to have more side effects than the younger patients, and even though they do have more side effects, if we manage those side effects aggressively, the overall outcomes in older patients are similar to that of younger patients. And it is important for the treating oncologist to realize that older patients, while they have more side effects and need to be taken care of more closely, do just as well as younger patients.